I believe that one of the most appropriate methods to measure success in IVF is the cumulative live birth rate. We shouldn't any longer count everything on the fresh embryo transfer cycles, but we should start thinking and we should start counseling our patients on the chances to have a live birth after having used all the embryos obtained with an individualized controlled ovarian stimulation with multiple frozen thawed single embryo transfers. In our clinic, we use also as a measure of success the time to live birth. I believe it is important to reduce the time to live birth as much as possible by selecting the blastocyst with the highest chance to implant and to give a live birth. In my opinion, the methodological developments which can improve the efficiency of assisted reproductive techniques in the near future are in the lab. And with these techniques, we will be able to select the most competent embryo with non-invasive methods, as time-lapse monitoring or the assessment of microRNAs in the sperm culture media, or with minimally invasive methods, as PGT, preimplantation genetic testing for aneuploidies, or the assessment of the mitochondrial DNA. The incredible improvement of the efficacy of cryopreservation of oocytes and embryos with the standardization of the vitrification technique will be, in my opinion, of utmost importance in the long-term future, especially in respect to fertility preservation and freeze-all strategy. In fact, in the last 5 years, we observed a dramatic increase of the oocyte cryopreservation procedures for fertility preservation. The number of women who defer their pregnancy for different reasons is increasing, and for sure it will continue to increase in the near future. The number of oocytes is a key factor to maximize the chance to have a live birth. According to the literature, the optimal number of oocytes to optimize the live birth rate per fresh embryo transfer cycle is between 10 and 15. In fact, increasing the number of oocytes to more than 15, the live birth rate in the fresh embryo transfer cycle will not increase anymore, or it will decrease, very likely due to a negative effect on the endometrium. But this is true only in the fresh embryo transfer cycles. If we consider fresh plus frozen thawed embryo transfer cycles, the cumulative live birth rate will continue to increase with the increase of the number of oocytes retrieved. In other words, the higher the oocyte number I will retrieve, the higher the cumulative live birth rate I will achieve. I think that preimplantation genetic testing for aneuploidies has an important role in IVF today, and I believe that the evolution of the diagnostic techniques will improve the efficiency and the reliability of preimplantation genetic testing for aneuploidies. In fact, by selecting the single blastocyst with the highest chance to implant and to give a live birth using preimplantation genetic testing for aneuploidies, possibly together with time-lapse monitoring and other non-invasive methods, we shorten the time to live birth. We reduce the miscarriage rate and the multiple pregnancies that should be considered as one of the most important complications of IVF. In other words, we will improve the efficiency of our IVF treatments. The most challenging patient population is the group of patients with advanced maternal age. In our units, 84% of the patients are more than 35 years old. In this group of patients, we have a low chance to find a competent embryo. The most of the blastocysts obtained in these women are in fact aneuploid. And normally we can retrieve a low number of oocytes due to a reduced ovarian reserve. A possible strategy to improve the efficacy and efficiency could be the dual stimulation, which it will allow to increase the number of oocytes retrieved per menstrual cycle, and therefore increasing the chance to obtain a competent blastocyst that will give a live birth. According to my clinical experience, I believe that we should aim to reduce the time to live birth. To better reach this goal, we should optimize the number of oocytes to be retrieved with individualized ovarian stimulation to maximize cumulative live birth rate. We should try to select the single embryo possible at the blastocyst stage, with the highest chance to implant and to give a live birth. To do this, it is of utmost importance to have a very good and technological lab with a very good cryopreservation program.